I always say that awake shoulder and elbow surgery is not right for every procedure, every patient, or every surgeon. Not all procedures can be done under regional anesthesia. Some procedures require muscle relaxation, which can only be done with a patient under general anesthetic, as that general muscle relaxation will stop the muscles from breathing. There are some upper limb operations, such as operations on the clavicle, that will not be covered effectively by regional anesthesia. And for some very long operations, such as significant major trauma operations, having a patient awake under regional anesthesia may be difficult for the patient. So in those cases, I wouldn't always recommend regional anesthesia unless the patient's unfit for a general anesthetic. Also, from a surgical point of view, delivering surgery safely and effectively under regional anesthesia does take some special surgical skills, and so not every surgeon may want to offer this as a service. But I've trained with colleagues around the UK to deliver this surgery safely for patients. And then finally, some patients have severe concerns about being awake during surgery, may be severely anxious, and while we can control anxiety with sedation, some patients will just not want to know what's going on during their operation. So we have this discussion in clinic, and we work out whether the procedure is right for them, and whether the procedure is right for awake shoulder surgery, and whether awake shoulder surgery is right for them. What do you think, Rony?
I think that's a fair point, and having awake surgery is right for some patients, some surgery, and some surgeon. I think that's absolutely right. What I would say is, from a purely medical point of view, awake surgery is possible for 99% of patients. There's a few neurological conditions that will be a contraindication to that technique, but most patients will be able to benefit from it. One thing that patients are really concerned, and that makes them really anxious, is actually believing that it's going to work. So, well, what I see very often is I offer them that procedure. We've agreed that this is the right thing to do for that operation, and then I do that injection of painkiller, and then they realize their arm is really heavy and numb, they can't feel anything. So then all of a sudden they don't want that sedation, general anesthetic, because they think, oh wow, okay, it's working. Like, why would I take the risk? Why would I be knocked off for a few hours and then be drowsy the whole day and then feeling sick? So it happened quite often where actually we get away by doing it that way, and we have Nick's very nice pop music playlist playing in the background, and we're talking to each other, and I get to know my patient as well. So it's quite fun. Some patients, they're overly anxious, and we can offer sedation. So sedation has to be seen, it's a bit like taking a sleeping tablet. I'll still be able to wake them up, but they will be like literally snoring. They won't remember anything, won't see anything. And then they wake up, it's like, oh, so when's my operation? Oh, is it done yet? Okay, cool. So it works. And then, as Nick said, some patients, it's just not possible. That's fine. We'll do the painkiller injection just so that my patient will be very comfortable after the operation, general anesthetic, and done. So, what do you think? Yeah.
I totally agree. Previously, we were unable to offer awake shoulder surgery to patients who didn't speak English, because we wouldn't be able to communicate with them throughout the operation and keep them calm and comfortable. But Rony and I have actually worked together with a team at our hospital and developed an app that will allow us to communicate with patients in 8 languages during their awake surgery. So that allows us to offer this to more patients who may need surgery on their shoulders and elbows.